In situations where we have very difficult decisions in front of us, we often put an undue burden on the family member to simultaneously advocate for their loved one and try to make decisions based on the relationship that they have with their loved one, and at the same time make fairly complex or complicated medical decisions that on a rational level make sense, but might conflict with their relationship with their loved one. And I often argue that that's an unfair thing that we ask of family members. And this is a way to really make it clear what the patient wants.
I was part of a large task force that extended statewide to think about how we can do a better job of really respecting patients' wishes and making sure their clinical choices are known in times of emergency. At the end of that process, we developed a new product called NETO. It stands for Nebraska Emergency Treatment Orders, and it's just a better representation of what patients really need to convey to medical providers in times of an emergency when they might not be able to speak for themselves.
What the current standard of practice is to do multiple forms that were not able to be brought from one place to another. So the NETO form, it replaces 5 forms that we were doing for each client.
It's really important to think about having a system of care. It takes a lot more than just having a piece of paper or just having a conversation. The conversation is important, but it's just one piece of the pie. You've got to be able to get the contents of that information to the place you need it. So does EMS know what to do with it? Is there a place in the medical record for it? And then do emergency room physicians and clinicians know what to do with that information? When it comes into the hospital, is the attending physician who's going to care for you during the hospitalization aware of it? So it needs many pieces of the system to work together well. And what this gives us the opportunity to do is for every part of the system to work to its highest level.
I do hear a lot of providers talk about how this is sort of a long time coming. We've been working on trying to bridge this gap of how do we provide a system for honoring patient wishes when we know what they are. Our current advanced directives don't really represent that as well as they could. And I think this NETO form is an attempt to make a much more robust and much more clear advanced directive.
I wish I had the NETO form from day one on house calls. We've had different clients with complex medical needs, but also complex social needs. Too many specialists, too many family members all have a say in what's happening for the individual. Unfortunately, that individual, the patient, was just too weak and too frail to make any decisions for themselves.
And a classic example is, being called to the intensive care unit 3 or 4 days into the hospitalization of an elder, sitting down with the family saying, oh, she never wanted this. She never wanted to be on a respirator. She wanted to be able to die comfortably the next time something happened. But here we are. She's on the respirator, and now someone has to decide to take her off. And the weight that leaves on the family is so consuming for them, and it can impact their lives for years, and certainly months, feeling if they made the right decision. If we had that patient's decision at the time of hospitalization, we could have assessed her and said, you know what, this really is the bad stroke she was afraid of, or this really is the overwhelming infection. She just wanted to be kept comfortable and allowed to pass naturally, rather than going through days of unnecessary treatment and then burdening her family with that decision.